Welcome to Emily Creates. Today I wanted to talk about my career journey so far. So back 11 years ago, I started working in health and social care. I started doing a foundation degree in mental health practice and worked as a home carer. So worked with people who had dementia, other severe mental health conditions, and people who are disabled due to a multitude of factors. And then I was there for a couple of years. I then moved on to become a healthcare assistant for the NHS. So although it was similar in terms of personal care, it was in one place, which is what I quite liked. I really liked to work as part of a team as well in the hospital. So I was there for a few years. Then I moved on to becoming a support worker, so visiting people in their own homes again, like I did as a home carer. But I was visiting for more practical reasons, so helping people complete benefit forms, helping people to live independently at home, really. That was the main goal. And again, worked with people with mental health challenges. And from there, I moved on to become a social prescriber. So social prescribers, well, near me, are based in GP surgeries, and social prescribing is a non-clinical role where you support people with their well-being through signposting to resources and groups that would be appropriate for them, and also being that listening ear to be able to, for these people who, a lot of them are lonely, to be able to have some outlet and somebody impartial to talk to. Because even the people that have got people they can rely on to talk to, they might feel like, well, a lot of people did say they felt like a burden and that they couldn't really properly divulge that information to their family and friends. So yeah, and throughout that experience as a social prescriber, I was using a lot of digital resources, and I came across so many people who were not able to access tech. So they didn't have a smartphone, they didn't have a computer, they didn't have access to the internet, or they didn't have the education, like the specific education in tech or any practice in doing so, or they just felt scared by the whole idea of using tech, because people around them might have spoken about tech and the internet in a way that scared them, or that's maybe the idea they got from watching something on the TV or reading something in the newspaper. So that was a challenge, and it meant that the information that I could share was very limited. There are so many valuable resources on the internet, so on websites or via apps, and I was just thinking how amazing it is that information is available for people, but how it's not accessible to so many. And I really felt that that's something that I wanted to work on. I felt like I'd really built up an understanding from working one-on-one with vulnerable people for such a long time, over a decade. And I really felt that these experiences I've had and all the people that I've met, that I could use that knowledge to inform apps and the design of apps and websites. So yeah, that has led me to starting a career in user experience design.